to highlight the need for malaria control and prevention, the Kingsley Holgate Foundation has made a call for governments, healthcare workers and citizens of Africa to not forget the scourge of this disease amidst the focus on COVID-19, the pandemic. As the pandemic continues to dominate the health and political agendas in many countries around the world, so its devastating impact on other diseases becomes increasingly apparent. Malaria is, of course, one of those. Over 90% of malaria deaths occur in sub-Saharan Africa, the majority, more than 265,000, in children under the age of 5. Ross Holgate is head of the Kingsley Holgate Foundation, and he joins us now. Very good evening to you, and thank you so much for speaking to us.
Good evening to you, SABC. I hope I pronounced that correctly. I do apologize if I didn't.
You're absolutely on the money, and I appreciate your asking. So let's talk about, we know that most healthcare services were disrupted when the focus and the resources were shifted and diverted to dealing with COVID-19. I'm curious as to how the fight against malaria was impacted.
Yeah, just to kind of give you a bit of a background, SABC, is we're adventurers by heart, and we're a sort of family team unit with some friends as volunteers that join us. So we go out into Africa to do sometimes world first adventures, and linked to that is a campaign, and we've sort of classified it as using these adventures to save and improve lives. So we're all about adventures. We're all about getting to the most rural, difficult places in Africa and doing good. Now, obviously, with COVID, borders have been shut down, lockdown measures have been in place. Trying to get insecticide-treated mosquito nets from other parts of the world delivered to Africa has just been has been a complete hardship. So, yes, that has sort of been our biggest obstacle. We were quite relieved, though, that we did have stock of mosquito nets in specific countries, especially in Mozambique, which is the hardest hit country. So through some of our partners in those countries, we were able to continue with the distribution of mosquito nets to those that are most vulnerable, which is pregnant mothers and children under the age of 5.
Okay.
And to add to that, sorry, I apologize.
No, it's fine. Ross, I actually wanted to ask you, so we'll get to some of the areas that you've been through, but have you seen a rise in malaria deaths as a result of, as I mentioned, the disruption of healthcare services to, efforts such as reducing the number of malaria deaths?
SABC, we get a lot of our statistics back from the World Health Organization, like everyone else does. So we're sort of still waiting on the effect from the sort of COVID-20. But yes, we were told categorically by WHO that if we didn't continue with the fight against malaria and with the disruption, that malaria cases would definitely increase. So we're going to see it, unfortunately. And listen, like you said in the beginning, when you opened the sort of interview, the horrific statistic is that if I want to kind of break it down to its most sort of important essential, is that a baby dies every 2 minutes around the clock from malaria. That's how drastic it is. And I know we're kind of fighting this pandemic, and the world and the media are all sort of, following this COVID thing, but there are other realities out there. And because it is World Malaria Day today, we need to take advantage of this and tell everyone, the citizens of Africa, governments, healthcare workers, please, let's not forget about a disease that kills over 400,000 people alone in sub-Saharan Africa.
So as you say, you've had about 37 geographic expeditions with various partners, including Goodbye Malaria, as well as Land Rover, I think. And from what you've said is that Mozambique has been deemed one of those most vulnerable. Tell me about what you found there.
Currently, Mozambique is one of the most affected countries by malaria. But, to add to that, if we just look over the last few years with the cyclones, the poor country. And now with the insurgents in the north in Cabo Delgado province, with the insurgents of ISIS-related attacks, you're having hundreds of thousands of people move into refugee camps towards the sort of South and Pemba area. So, the rise in malaria because of people coming together and other related diseases is just increasing. Down in the south of Mozambique, where we where the Goodbye Malaria campaign, which is an indoor residual spraying program, is very active. That has been very, very successful. In fact, our 2020-2021 malaria spraying program has just come to an end. We managed to spray cumulatively 560,000 structures, over 600,000 homes. So that kept over 2 million people safe over this COVID, if you want to call it the COVID period. But what was also incredible, because we know what COVID has done to the economy, is that we managed to keep 2,500 people employed, of which 65% of those are women. So, yes, there is doom and gloom, but we have managed to sort of keep the accelerator on the fight against malaria.
I want to talk about something that I've always found. Firstly, we know malaria is preventable, but this part of it that people forget, the triage in terms of the fight against AIDS, tuberculosis and malaria, how they interact with each other. How have you been able to battle it out, and what resources do people need? Because we know there's been a lot of malnutrition as a result of COVID-19. We also know that there have been stockouts. But how do you deal with the spectre of all three?
That's the big issue. It's a bit like everyone's saying COVID-related deaths. It's now becoming, everything is just becoming related. TB-related, AIDS-related, COVID-related, malaria-related. But we got to get back to our focus, which is malaria, Tsepiso, and the World Health Organization. Until we get a vaccine, same as COVID for malaria, the most effective measure against malaria is the use of insecticide-treated bed nets and indoor residual spraying, and we just have to keep plodding on. We're seeing some great results. I mean, when we started our sort of fight against malaria nearly 17 years ago, the shocking statistic then was that a baby was dying every 30 seconds. I know it sounds ridiculous, but it's now every 2 minutes. So there's been a definite improvement, and we just have to keep on fighting. We can't give up, and that's what we're going to continue to do.
Thank you for taking the time to speak to us, Ross Holgate, head of the Kingsley Holgate Foundation, that is carrying out various expeditions in order to deal with malaria. It is World Malaria Day today, and we know that there's been several campaigns